personalized matrix for wide boxes in Class 2 preparations. This topic is part of our case review series. I want to start by thanking our sponsors, Colteen, Oral Arts Dental Laboratories, and Romero Dental Seminars for making these case series reviews possible. I also want to stimulate everyone in our webinar to visit and subscribe to our YouTube channel, Romero Dental Seminars. Our objectives for today: number one, understand when a personalized matrix is needed, learn how to fabricate a personalized matrix, and highlight the step-by-step protocol for its use. So let's go into our review step number one. When is it needed? So in order for us to understand when a personalized matrix is needed, I want to start sharing with you this clinical case, because this clinical case is going to be a really good example of when this protocol, or when a personalized matrix would be needed. What you are seeing here is tooth number 13 and 14 that were restored some years prior. And I want you to observe the over contour distal wall of tooth number 13. At the same time, I want you to observe the flat mesial wall of tooth number 14. And not only that the contact area, or the contact point, is not ideal, but I want you to compare the buccal embrasure between 13 and 14 with the lingual embrasure between the same teeth. And then I want you to compare it to the buccal embrasure between 12 and 13 and the buccal embrasure between 14 and 15. As you can see, the buccal embrasure between 13 and 14 is completely different, is much wider, allowing food impaction, food collection, and gingival irritation. And that's the reason why this patient presented to our practice. So once we removed, and I decided to do this case, instead of doing it back to back, I decided to do one at a time. The reason for this is because I knew that the distal box of tooth number 13 was going to be a wide box. And what you're seeing here is not only a deep box, is approximately 4 to 5 millimeters from the marginal ridge of the neighboring tooth, but at the same time is a wide box, is a 5 to 5.5 millimeter wide box from buccal to lingual. So when you think about this, if you were to restore this distal box using let's say a Garrison ring, well, depending on the Garrison ring that you choose, you may end up impinging, the band may end up impinging in this area, in the area where my yellow arrows are located. And this will definitely deform the anatomy of your proximal contact. And that is most likely what happened with the previous dentist when they restored this case. They did not select the correct band, and because of that, the band impinged or deformed that sectional matrix and allowed for that wider buccal embrasure. So in a case like this, I would definitely select, as a good example, would be the wide prep Garrison band, as you are seeing here in this photo. This band has one positive thing. As you can see, the prongs of the band are much wider, so they will engage with a lot more tooth structure, mesial and distal, to the box that you're trying to restore. Now on the downside, this band will create less pressure between both of the teeth. So there will be less separation of the teeth gained by this type of band. So if you look at this closely, you can see that I've been able to adapt very well my matrix band around tooth number 13, but I've also created a space between the distal wall that I'm going to be building on tooth number 13 and the mesial wall, the current mesial wall of tooth number 14. So this band, so two things that I'm going to accomplish here. Number one, I'm not going to have an over contour proximal wall like I did before, or the patient had before. And at the same time, these prongs, this wide prep band, does not impinge, as you can see, on the contact area, does not impinge on the embrasure area of my bands, allowing the band to have a very nice and anatomical form. Now, I have to make sure, and this is the reason why I did these separated I separated these two restorations. When I go ahead and restore tooth number 14, I got to make sure that I select the band that creates enough pressure in between these teeth that allows for a little bit of separation and a really and allowing me to reestablish a really good interproximal contact. So those are the things that as a clinician you should be thinking of when you're confronted with cases like this. So you can see now I'm building the proximal wall of tooth number 13. And once I'm done restoring tooth number 13, I'm going to remove that garrison ring. I'm going to prep the neighboring tooth. I'm going to place my band and select a different type of ring. As you can see here, I've just selected the standard blue ring, the short prong blue ring, which allows for increased pressure in between both of the teeth that are being where the actual ring is being supported at. So in this case, between 13 and 14. Not only that I'm able to create some separation between these teeth, but I also am able to, you can see the nice anatomical contour of the proximal band, where I'm sure that I'm going to be able to reestablish a nice and wide contact between these teeth, but at the same time keeping the natural buccal and lingual embrasures, which was really what I wanted to try to solve for this patient, because this excessively wide buccal embrasure was allowing food impaction and gingival irritation. So now you can see that I've been able to restore the proximal wall of tooth number 14. And at the end of my restorations, you can see how I was able to reestablish not only a very nice and wide contact, 2 to 3 millimeter buccal to lingual width, but look at the buccal and lingual embrasures. They're very nice and uniform. They are similar in shape and size to the neighboring buccal embrasures and lingual embrasures with the adjacent teeth. So again, we have accomplished our goal of not only reestablishing an ideal and anatomical contact, but at the same time an ideal and anatomical buccal and lingual embrasure for this patient. Now, what happens when you have a case like this? You see, in a case like this, not even the wide prep garrison ring is going to be able to help you. And the reason for that is because tooth, in this particular case, this second premolar, even though that proximal contact is a little bit flat, has been affected most likely when they prepped tooth number 3. I am able to recontour that, but I don't have any restoration for me to do on tooth number 4. So I'm only able to I only need to restore one tooth, and if I use the wide prep band, most likely my contact is either going to be non-existent or very, very light. Again, because of the reduced pressure that this type of ring exerts over the teeth that is being held on to. So please keep that in mind. So for a case like this, what would be the ideal situation? And this is the ideal case for a personalized matrix band. So how do we fabricate? This comes now to the review of step number 2. How do I fabricate a personalized matrix? So now you know which would be the ideal case, and this is the ideal case for a personalized matrix band. And when and how do I do it? Now this is the initial, the preoperative photo of this same case. Now, as you can see, even though there's an actual cavity into the tooth, and there's a cavitation when the patient presented to our clinic, you can see that there's still some of that proximal wall that even though I have to remove it because it's undermined enamel, beyond these white lines, you can see that this is undermined enamel. There's caries, there's decay underneath that enamel, so I'm going to need to remove these portions of the tooth. But before I decide to remove it, and because this is a natural contour of that buccal and lingual embrasure given by that beautiful enamel that is still remaining there, that I'm going to have to remove, but it's still there, what I'm going to recommend for you to do is go ahead and make an impression using a bite registration material of that buccal and lingual embrasures, or that buccal and lingual enamel in that mesial box, before you remove the tooth structure. And that's exactly what I did. You can see that I was able to just squirt some bite registration material, any brand that you use in your office, a little bit on the buccal, a little bit on the lingual. You do it in two separate steps. I'm showing you only the buccal here, but I did the same for the lingual, and then you put those aside. Once this PVS sets, just put it aside, and then you go back and start working on your preparation. And as you can see, I'm using caries detection dye. I was able to remove that unsupported enamel. I have better access to the cavitated and the caries lesion. I'm going to make sure that by using that caries detection dye, I identify, the deep caries from the more superficial caries. I also identify where my peripheral seal zone is and how much decay do I need to remove from that peripheral seal zone to accomplish the best bonding possible, and where can I leave some of that affected or even sometimes infected dentin near that axial wall, just because I don't want to I don't want to expose the pulp. I don't want to aggravate the nerve of this tooth. I want to make sure that I stay away from those deeper areas, because these are the areas where I can compromise the vitality of this tooth. This tooth had good response to cold testing, so there was no lingering pain. The pulp was healthy, so we want to keep this tooth by all means vital. So once I remove that unsupported enamel and I removed all the decay, you can see that I'm using here that lingual, in this case, first I'm using the buccal matrix. And that buccal matrix, I added some composite to that buccal matrix, and I'm now reestablishing that area, that, ideal anatomy of that buccal wall extension of my enamel. I'm rebuilding it with composite, but using this matrix that was a copy of what actually the tooth had, what nature had given this tooth. And I'm going to do the same thing on the lingual wall. And with that, now I'm going to be able to now use my Garrison ring. They're just the basic Garrison ring. In this particular, the short one instead of the tall. The orange is the tall, the blue is a short Garrison ring. This is going to exert enough pressure for me to accomplish a slight separation between these two teeth and reestablish a nice interproximal contact. But as you can see, I have the prongs have exactly, they have an area of composite where they have positive seating, so that this is not affecting the shape of that sectional matrix. And that's what's crucial here. I've also elevated the margin, and I'll show you that when I go through the step protocol of this case. But now I'm ready to restore that proximal wall. And if I restore that proximal wall, I'm ready to establish a nice interproximal contact. So that I really want to make sure that I explain this step by step. I'm going to now review the step number 3, which is a step-by-step protocol of the same case, so that you know exactly when and how to use this customized matrix band. Again, this is the initial clinical situation. This is me obtaining that impression on the buccal, and then I do the same on the lingual embrasures before I remove that unsupported enamel. I have now started removing the unsupported enamel. I always recommend placing some Teflon tape to separate the rubber dam from those deep areas, and I recommend this mainly when you have deep caries in your proximal boxes, because by doing this, by placing that Teflon tape into that sulcus between the tooth and the rubber dam, what you're trying to do and what you're really trying to accomplish is separating or pushing the rubber dam away from that critical area. Because the deeper you get into those areas with your burr, for you to remove the decay, and as you can see, that's very soft dentin, I'm gonna have to deepen that box. If the rubber dam is in the way, I'm going to tear the rubber dam, and now I'm losing the main function of the rubber dam, which is to stay underneath that gingival sulcus, so that I prevent that clavicular fluid from affecting this critical area, which is the floor of that box. So by keeping that Teflon in place, you can see now I'm applying my caries detection dye. That's gonna allow me to visualize where that staining is and where that soft caries is, and now it allows me to clean. You can see now that I've been able to clean that little bit of enamel left on that deep box, but most importantly, that dentin and that DEJ, because I want to make sure that I have a nice and clean caries-free peripheral seal zone, which is approximately 2 millimeters from the DEJ on that proximal box, 2 millimeters axial. So you can see here, I've been able now to accomplish a very nice and clean peripheral seal zone. I have a deep central safe zone that is still stained with light stain, I would say, with the caries detection dye, which means that there's still affected and even a little bit of infected dentin in that area that I'm leaving just because I am too deep into that axial wall. I'm more than 3 millimeters from that from the marginal ridge of the adjacent tooth. So I want to make sure that I stay away from that, because I know that if I'm beyond the 3 millimeters, I am going to be very, very close to that pulp chamber. And I don't want to, again, expose in any way, shape, or form any of the horns or any of the pulp. So what you're seeing here is I'm trying to place a metal band just to elevate that margin. You can see that this is a deep margin. So I'm trying to adapt that band as best as possible to that gingival floor. Once I accomplish that, I'm gonna use my 2-bottle adhesive system, primer and bonding, and then I'm gonna light cure that prime and bond. I'm gonna resin coat that prime and bond, and then I'm gonna go ahead and elevate my deep margin as you are seeing in this photo. And all I'm trying to accomplish is to bring that margin, a millimeter above the rubber dam, because what I want to try to accomplish now is just go ahead and use that a sectional matrix so that I can reestablish the contact. Now here, I have not yet reestablished my proximal walls. So I haven't used that PVS yet. All I have accomplished here is just my deep margin elevation. So now, in order for me to, strengthen that core, strengthen this composite, and also, accomplish a better seal in that gingival, in that connection between that deep margin elevation and that proximal wall that I'm going to start building up soon, I'm going to use a ribbon fiber. This is a 2 millimeter wide by 3 millimeter long ribbon fiber that I'm placing within that axial wall, also contacting that the new gingival floor that was recreated with my deep margin elevation. And you can see now I've incorporated that fiber within this restoration. I'm going to go ahead and do what we call reverse selective etching of the enamel. I'm going to rinse, I'm going to dry, and I'm going to now place my new band. I'm going to build my proximal walls, the buccal and the lingual, so that now, after building those proximal walls using that personalized matrix band, now I'm able to place my sectional matrix, use my Garrison short ring that is going to again recreate that added separation, or create some pressure in between 3 and 4, so that it separates slightly these teeth, and that allows me to accomplish a really nice and tight contact. I think that the Garrison ring is definitely my number one, and I'm still using the 3D Fusion, but this is definitely my number one matrix system to use for any class 2. And once I have completed my final enamel layer on that restoration, I remove the band, I finish, I polish my restoration, I adjust the occlusion, and you can see right here on my bite wing, that deep margin elevation and that new proximal wall, how that they're both bio-integrated. But most importantly, you can also see a little bit of the shadow that's created because of the fiber that I place within that tooth. And now you can see that this shadow is not a bubble. This shadow is very nice and uniform, and it actually has the same C shape that I gave that fiber when I was placing it within that restoration, so that I can reinforce my restoration and give this patient, a good 15 to 20 year long span of this completed direct composite restoration. So with this is my final slide. If you have any questions, please make sure to write them down in our chat box. I always go get back to my questions and give you any answers to any questions you may have. And I hope that you have enjoyed today's webinar on this very, very good clinical tip, which is this personalized matrix technique. But most importantly, that you also have, take home that message of when to use the different bands that Garrison offers, and when these bands are not enough and you need to combine them with a personalized matrix technique as the one that I shared with you today in this case. I hope that you enjoyed today's topic, and I hope to see you again during our next webinar. Thank you very much for your time.